All right, Mike, thank you. Governor Ron DeSantis continues saying things are not as bad as some think they are in Florida, but at least one decision he announced today says otherwise.
He's sending 100 healthcare workers, mostly nurses, to Jackson Memorial Hospital as they struggle to keep up there. CBS 4's Jim DeFede spoke with the CEO of Jackson Health System, Carlos Migoya, about that and other concerns.
As you well know, the numbers have been rising now for the last 14 days. And we're at a point where we're still balancing things out. We slowed down our elective surgeries last week, and we've been able to move the census around as some of those surgery patients are moving out, discharging. We've been able to replace those with COVID patients. So we've been having a balance. It has not been easy from an operational perspective. Obviously, we've been having a lot of challenges and continue to have challenges. Our census stays at a high level, but not at a urgently high level. The concern that I've had, and I continue to have, is if this pace continues over the next several weeks, we will have a major issue. Yesterday, I got a phone call from the governor's office saying that they can provide us through the contracting side up to 100 nurses. We said we're absolutely happy to do so, and that's how the conversation got started.
So
and
I just want to be clear. So did you request that they bring you nurses? Did you request help from the state to send you nurses?
So we've been talking about the challenges, and they offered the ability to have nurses. And when they offered that, I took the chance to say, yes, we'll take those extra 100 nurses. Do we need those extra 100 nurses today? No. Do we need the nurses over the next several weeks as these numbers will happen? Absolutely. So we are using this right now to make sure that we take as many of these nurses as possible. These nurses will come over the next several days. They're not coming in one day.
I'm confused, though. You say you don't need these 100 nurses right now. You're predicting that you're going to need them in the future. Yet, from the conversations I've had, whether it's with Martha Baker or others inside the hospital, they say that staffing has been a major issue, that you have been trying to beef up staff by offering bonuses to employees, to work extra shifts. That hasn't gone over very well. One nurse described to me, they said that she considers it chaos inside the situation. We've had nurses describe to us situations where the ratio of nurses to patients in the ICU is supposed to be 1 to 2, but in some cases supposed to be 1 to 1, depending on the level of care that person needs, and that's not been able to be met.
My point is, can we handle it today? Yes, we can handle it today. But the numbers keep creeping up. And we believe that as the numbers continue to creep up and the fact that our people are tired, we need to make sure we have relief. So that's the reason for having the need for those extra 100 nurses. And we will continue to make sure that we have those 100 nurses, whether we have them from the governor's office or wherever else. In addition to that, we've over the last 2 weeks, we've hired an additional 80 nurses. Those 80 nurses will be fully trained and ready to go in the next 2 to 3 weeks. So therefore, these 100 nurses help us with those 80 nurses. And depending on what happens, this is a balancing game, Jim. I don't know what's going to happen. Today, we have 340 patients with COVID at Jackson. That number could be 400 or 500. We need to balance this as we're going through. I can't turn the switch on and off in a day's notice. It takes several weeks, and that's why those nurses are needed.
But let's talk about testing, and let's talk about what's going on inside Jackson. Prior to June, the positivity rate among tests for Jackson employees was around 7%. In the month of June, it was closer to, I think, 11 or 12% positivity. But that was but you only, as I understand it, test staff that show symptoms. Should you not be doing more widespread testing, surveillance testing, to test more of the staff to try to get a handle on what's walking through the door every day?
So what we're doing is we're testing nurses, or actually all employees that have symptoms. In addition to that, we do also contact tracing within our own system. So therefore, if any one of our employees are in contact with any of those that have been positive, we test those as well. That number has been, you're absolutely right, it was 7% before the end of May. It was 12% in the month of June for those people that we tested, not for every employee. And right now, the numbers run a little higher than that. Numbers between 18 and 20% or so for the month of July. For those that we have tested. How many nurses are out? I'm going to get, and maybe I'm going to give you the answer to your question you're about to ask.
Go ahead.
So right now, we have 32 nurses that are out for COVID positive is the number. We have a total of 110 employees that are out for COVID positive. Those 100 nurses we're talking about kind of helps us with those kind of numbers as well.
Okay, now Jim DeFede is joining us live. And Jim, the fact that 18 to 20% of hospital employees tested positive for coronavirus is quite a jump. Are they planning more testing?
Quite frankly, no. I specifically asked Carlos Migoya repeatedly whether or not he believed there should be more widespread surveillance type testing to understand how many of his employees are testing positive for the coronavirus. He basically said they're only going to test people who show symptoms. We all know that asymptomatic spread is a major problem. But the reality is this. I think they would want to do more testing. The reality is they can't. They do not have the testing agents to be able to really understand what's going on. So the test kits are incomplete. They only have the capacity to do 500 tests a day internally. The tests that they send outside take a day, 2 days, 3 days, sometimes longer to get back. So the problem is testing. We've been hearing about it for months. Testing is still a problem, especially within Jackson.
All right, Jim, from testing to treatment, there are reports that the hospital is out of a major treatment drug, remdesivir. It's the drug that has proven most effective in treating the virus. So how is something like that possible, and what does it mean for patients there?
Look, there's just a shortage of the drug. There's a manufacturer that was producing it. He never had to produce it in large quantities before. Now it's in demand. The federal government stepped in and prevented the manufacturer from shipping it anywhere overseas. They sort of took control of it, but it's not enough. The federal government was controlling the supply of remdesivir and was sending it to the state, which in turn would then send it to Jackson. That's now going to change. Jackson and other hospitals are going to be dealing directly with the distributors to try to get remdesivir into the hospitals. I don't know how that's going to work. We've seen that before. When you have all the hospitals and all the counties across the country competing for the same item, it does not generally go well. So remdesivir is a major problem right now for the hospital. And one of the things I will tell you is that I asked, are there patients at the hospital right now that would benefit from remdesivir but are not able to get it because you've run out? And he would not answer the question because he said, well, that's a protocol issue for the doctors to decide. I'm not a doctor, I'm a banker. And in fact, Carlos Migoya is a banker. He's the financial head of the hospital system.
Yeah, that's right. Those numbers need to come down. Jim, thank you for that update from home.